Today we're going to talk about collecting colostrum, but I have a few important things to say before we begin. Collecting colostrum is not necessary to have a successful breastfeeding journey. Some people might find it really easy to collect colostrum while they're pregnant, while other people might find it really challenging and not really be able to get anything out. Both of those situations are completely normal and don't have any bearing on your breastfeeding journey postpartum. I would not recommend collecting colostrum unless you're at least 37 weeks, and I highly recommend getting it cleared by your OB before you start trying. Removing colostrum during pregnancy doesn't take away anything from baby once they're born, and it doesn't actually impact your supply postpartum. What it can do is help support your baby if they need to supplement for any reason after they're born. Typically, the people that will benefit most from collecting colostrum are those that have a higher likelihood of needing to supplement their baby postpartum. This can include gestational diabetes, growth restriction, large babies, small babies, a history of low supply, or a history of preterm births. All right, now that we've cleared it up, let's talk about how to do it. So what I like most about this pack is that it comes with really small colostrum collectors. I find this really important because the big ones can make people feel like they need to be filling them up, and a lot of people are not going to be collecting a lot of colostrum. Small amounts are very normal, and I find this to be a much more realistic size for the colostrum that you'll collect. So these come pre-sterilized, you can use them right out of the box. And when you first start trying to collect colostrum, I recommend hand expressing. I find it can remove colostrum a little bit better than a pump. So to hand express, you wanna wash your hands first. And then when you position your hand, you're gonna form a C, go a couple inches behind the areola, and you're gonna press back towards your chest wall and then try to squeeze your fingers together like this. You want to be gentle when you do this. It should not be painful. And you want to try to target different areas and different milk ducts by moving your hand. So one area, then the next. You just squeeze the colostrum collector and it'll pull up any drops that you get. And breast milk is good in the fridge for 4 days. So what you can do is after you're done collecting, you can put this in the fridge and you can add to it for up to 4 days. But on the 4th day, this should be put in the freezer. Now, if you're having a really hard time with hand expressing and it's just not working, the next thing I would recommend is trying a hand pump. When you use the hand pump, I would recommend doing some breast compression while you pump. One hand, you're activating the pump, and the other hand, you're just doing gentle compression in different areas to help that colostrum flow. Whatever you get in your hand pump, you can pour it into these colostrum collectors to freeze. The reason I like storing frozen colostrum in these is because you can also use this to feed your baby. If baby needs to be supplemented for any reason, you take this out of the freezer, let it thaw, and then you can use this to feed baby directly into their mouth. If you have any questions about collecting colostrum, feel free to drop them in the comments. And if you're looking for a colostrum collector pack, I highly recommend this one from Haka.